My goal here at the Drukier Institute for Children's Health is to create a research environment, both basic and patient-oriented, that will lead to discoveries, especially new treatments, to improve the life of sick children. Systemic onset juvenile arthritis has been the main focus of our research because no therapy was working.
When I first started, these were the hardest children to treat. They really didn't respond to any medications and were treated largely with high-dose steroids. And the problem with this was that they suffered from tremendous side effects, including gaining of weight, changing in their face. They would be severely immunosuppressed, and specifically, they got a lot of arthritis of their hips, and many of them needed to have hip replacements. There was really nothing to treat these children with.
We did some basic research and we discovered one molecule that we thought could be responsible for this disease. We developed a pilot clinical trial with a drug that had been developed to treat adult rheumatoid arthritis. That drug didn't work very well at all in adult arthritis, but we brought it to our kids and it worked very well.
You have children in the hospital who are desperately ill with daily fevers, and you give them the medication and it just stops instantaneously. It is one of the most remarkable things I have ever seen.
One of the cases we are collaborating with Dr. O'Neill is a 2-year-old, a precious Eva Chi, who has benefited tremendously from the therapies that we found.
We met her when she was really tiny and very sick. She came to us from another hospital with high spiking fevers. She was so ill. She was unbelievably anemic. She had terrible arthritis. Really all she did was cry. And then we started to use the IL-1 inhibitors. And the most amazing thing was this truly miserable child became happy.
Eva is a great example of how this therapy worked, how she could come out of it and go back to be a normal girl. So it is a very exciting time because we can really apply technology that we didn't have a few years ago that allow us to look at small volumes of blood, little piece of tissue, and we can really bring tremendous discoveries. So I am convinced that the future is very bright.
Because if we can bring a child to good health, we can give them good health for the rest of their lives.